Hello, my name is Christopher Murray. I am a Master's of Public Health student. I am presenting my final APE presentation um, for the Master's in Public Health program at Eastern Washington University. This final APE presentation is one that I worked very hard on. I'm very proud of the work that I did during my APE, so I'd love for everybody to hear about it. Oh, sorry. So the agenda will be I'll go through the introduction. We'll talk about the major work products accomplished, the activities completed during the APE, the connections to the SEEP competencies that was desired by the program, and conclusion and reflection. So in the introduction, we'll talk about the purpose of the report, the location of my APE, the site supervisor and mentor, and the roles of the student. So the purpose of this presentation is to highlight the accomplishments of my applied practice experience. The APE is a 6 weeks or more practical experience that is a requirement for graduation from the Masters of Public Health program at the Eastern Washington University. The presentation will highlight two major work products during my APE, as well as present an overview of my entire AP, applied practice experience. So the location of my APE was at the Office of Minority and Multicultural Health at the New Jersey Department of Health, which is located at 55 North Willow Street in Trenton, New Jersey. My site supervisor and mentor was Tia Hopkins, who is the Deputy Director of the Office of Minority and Multicultural Health, sorry. She has had a lengthy career in public health, including serving as an executive director at various YMCAs throughout the state of New Jersey. During my APE, she proved to be a wealth of knowledge. I appreciate her kind and patient approach to mentoring me. So the role of the student. As an intern at OMMH, my role was to assist with completing the deliverables of various team members. I primarily worked with the specific populations program team and quality improvement program team. Major work products that I accomplished. So my first major work product is a health equity assessment and learning tool overview and kickoff. There's a confidentiality notice because the HEAL tool is property of the NJDOH and as such should remain confidential. I was given special permission to use it only in relation to the completion of my master's in public health degree. My second major work product was a community assessment of the LGBTQ plus population of New Jersey. So my first major work product, which is the HEAL tool overview and kickoff, HEAL tool standing for Health Equity Assessment and Learning. During my APE, I developed a presentation detailing the overview of the HEAL tool application and the timeline of such, with the timeline being how it would be applied to a target program within the New Jersey Department of Health, and I gave this presentation to the team members of that program. That program is the Wise Women program. Now, the HEAL tool is an assessment tool to help organizations systematically address health inequities related to their programs and identify what they can do to help reduce inequities. The program it was intended to assess at the time was the Wise Women program. The Wise Women program is a program that offers access to free cardiovascular screenings, health coaching, nutrition classes, and other resources that will support a healthy lifestyle and reduce the risk of cardiovascular disease in poor and impoverished women of a certain age who live in New Jersey. Now, the second major work product was a community assessment of the LGBTQ plus population of New Jersey. The assessment included the demographic breakdown and healthcare needs of that specific population. So activities completed during my APE, we're going to go through the activities that took place to complete my major work products, both 1 and 2. So the major work product one, the inputs, activities, and evaluation. For my Heal Tool overview presentation creation, I partnered with D. Carmona, the office research scientist. He provided me with many of the visualizations utilized in creation of my Heal Tool overview presentation. I served as the primary liaison between the Wise Woman team members and the quality improvement team at OMMH during my applied practice experience. I also spearheaded the Heal Tool kickoff on the Wise Woman program. This included meeting face-to-face with members of the Wise Woman team and numerous email correspondences. I first had to familiarize myself with the Heal Tool through review of a provided playbook. I then completed a walkthrough of its application on a theoretical program. Nicole Winzel and Tia Hopkins worked with me to tailor the Heal tool towards the structure of the Wise Woman program and to develop a timeline of its implementation based on the workload of OMMH at the time. They also served as the supervisors, that's Nicole and Tia. They served as the supervisors of my work with the QI team and provided me with feedback after I delivered my presentation. I was then able to create the overview presentation. I was able to create the overview presentation using the NJDOH PowerPoint template that was provided for me. I will say that I was hoping to participate in the assessment of the Wise Women program using the HEAL tool, but because of factors outside of my control and outside of the control of my supervisor and mentor, I was not able, or the assessment of the Wise Women program had to be pushed back, which would have been outside of the timeline of my APE. Major work product number one, still the Heal tool overview. The outputs and the outcomes would be the main output being my major work product, which was the Heal tool overview presentation, which we already talked about before. And I delivered a successful presentation to the Wise Women team members. I also want to say that I anticipate a successful launch and utilization of the HEAL tool on the Wise Women program. This would include identification of health inequities related to the Wise Women program and the methods to help reduce those inequities. So the second major work product, which would be my community assessment of the LGBTQ population of New Jersey. At the start of my APE, I was given a set of parameters by my supervisor, Tia Hopkins, who also was the incoming lead of the specific populations team, which my community assessment was under. And those parameters included using qualitative and quantitative data to complete the assessment, as well as using public-facing data mainly. So that, and which is what I did. I use a variety of sources, namely the New Jersey State Health Assessment Data, NJSHAD, the Journal of Homosexuality, various New Jersey County Community Health Assessments, and other governmental website information, including information from the CDC, information from the World Health Organization as well, and other NGOs as well. This data was then analyzed and used to perform my community assessment of the LGBTQ plus population of New Jersey. So the outputs and outcomes of my major work product. So the main output from my activities was my second work product, which I already said was the community assessment of the LGBTQ population. This was delivered as a report and a presentation. I delivered the presentation in front of the entire OMMH team, who all provided feedback and critiques. My assessment will be used to guide future OMMH initiatives related to the LGBTQ plus population of New Jersey, and will result in collaborations with some of the organizations detailed in my assessment. So the connections to the SEEP competencies. So we have SEEP competency C2, which is to select quantitative and qualitative data collection methods appropriate for a given public health context. My LGBTQ community assessment, which is my second major work product, utilized quantitative data especially when detailing the demographics of the population, and qualitative data mainly when dealing with the health needs of the population. To demonstrate SEEP competency C4, which is interpret results of data analysis for public health research, policy, or practice, I use the creation of the LGBTQ plus community assessment to do this, which involved using a wide range of secondary data sources. Each data source analyzed their particular data sets, with analytical techniques varying between and across sources. I then had to decide how the results of each data analysis fit within the context of the results of the others. To demonstrate SEEP competency 6, which would be to discuss the means by which structural bias, social inequities, and racism undermine health and create challenges to achieving health equity at organizational, community, and societal levels, I use the ecological model of health as it relates to the LGBTQ plus community in New Jersey. So the ecological model that I use listed challenges to achieving health equity at the organization, community, and societal levels. I also looked at these challenges through the lens of the social determinants of health and how they affect the LGBTQ plus population of New Jersey. To demonstrate SEEP competency C7, which is to assess population needs, assets, and capacities that affect communities' health. I did that through the LGBTQ plus population assessment. Throughout the report and the presentation, these concepts can be readily identified. The report also delves into some of the underlying causes of the population's needs. So some of the population's needs that were looked at were the need for proper mental health healthcare providers in New Jersey that were sensitive to the healthcare needs of the LGBTQ plus population, the need for more financial resources for this specific population, as well as the need for methods to lower discrimination and to lower stigma. So the last competency is the SEEP competency C19, which is communicate audience appropriate public health content, both in writing and through oral presentation. I did this through my HEAL tool overview presentation, which communicated public health content in writing as well as orally, because I presented the overview in oral form to the members of the Wise Women team. The presentation was made appropriate for a team of public health professionals, all of whom had educational backgrounds that included tertiary education. My LGBTQ plus community assessment also communicated audience appropriate public health content. The audience, again, were public health professionals, and I gave an oral presentation on the key findings of my community assessment to the entire OMMH team, as discussed earlier. So my conclusion and reflection, my APE took place at the New Jersey Department of Health's Office of Minority and Multicultural Health. I was able to work as part of a dynamic and interconnected team of public health professionals. During my APE, I completed many tasks and gained many skills. Chief among my completed tasks were my two major work products, but I also assisted in other deliverables, such as creating health education material for Minority and Multicultural Health Week, as well as for webinars that OMMH was partnering with other specific population-focused organizations during my time doing my APE. The experiences I gained and the lessons learned throughout my APE will stay with me for the entirety of my public health career. I discovered my love of health education and promotion, and I hope to begin my career as a health educator soon. Thank you.